Yeah, so I think that symptoms are important. We also know that cardiac risk factors that we know that are risk factors for heart failure and coronary artery disease events in the general population are also strong risk factors for these events in the cancer population as well. So understanding their risk in terms of hypertension, diabetes, smoking, standard cardiac risk factor assessment and management is important, as well as most patients with newly diagnosed Hodgkin lymphoma will have a baseline echocardiogram. And we know that even a low normal ejection fraction is a risk factor for developing heart failure after. So really just recognizing not that these patients can't receive the planned cancer treatment, but perhaps involving working with a cardiologist to help optimize all their cardiac risk factors, control their blood pressure, and consider potentially a screening echocardiogram after treatment. There's several guidelines that the American Society of Clinical Oncology 2017 guidelines suggest that in patients who have risk factors, that a post-treatment echo can help identify early patients who are higher risk of developing heart failure. And, we have some sophisticated techniques as well, something called global longitudinal strain that is now routinely assessed on echocardiograms, just kind of to help assess a patient's risk of developing later heart failure. And then I think it's important to recognize that severe heart failure is preventable in a lot of patients. So we know that if we detect changes in echocardiograms early and start guideline-directed medical therapy for heart failure, such as ACE inhibitors, beta blockers, sacubitril valsartan, or other medications that we know can help prevent reductions in ejection fraction, that we can prevent a lot of heart failure events. So patients who have early changes in their echo, that we're likely able to prevent some patients from developing further declines.